The topic allotted to me today is how I've developed my practice in Tier 2 cities. And slowly as I take you through my talk, I'll talk about the past, the present, and what the future beholds as young spine surgeons who enter Tier 2 city for practice. So I'll just quickly run through the journey in the field of spine surgery. I started my training with Dr. Bhojraj in the city of Mumbai, followed by Singapore, then London, a brief stint in Germany and Korea, training under high-end microscopes, high HD loops, with neuromonitoring systems, cutting-edge technology, high-end Medtronic burrs, bone scalpels, and you name it, and you have all the gadgets whenever you're training, wherever you're training, with state-of-the-art of operating facilities, Jackson frames, Mackay tables. But then this is the present, what the scenario holds when I leave from the city of Mumbai, the city of dreams, to my state capital, Ranchi. A highly fellowship-trained individual with international publications, a lot of scholarships, workshops attended, but actually do these fellowships, publications, or scholarships get you a full-time consultant in a big private hospital or government institute? In my scenario, I was totally denied everywhere. Well, I feel it's good for your personal growth and good for development of your personal skills. Well, opportunities available in Jharkhand were 3 big government institutes, corporate setups where I'd applied for full-time consultant, part-time consultant, or visiting consultant. And I was denied everywhere. So there I was sitting and thinking and pondering that where did I go wrong? And I was trying to plan the long road ahead as to how do I proceed ahead. So I started the clinic from my uncle's house in a single room where the society also members denied me opening the clinic. But in case if you're not aware, 1/3 of your residence may be used for professional practice. So in case if you're denied, you can start a small clinic at your home. And there's a saying like, Asman se tapke khajur mein atke. It's like out of the fire into the frying pan. So I'll quickly run through my first case, which I was called by an elderly senior guy. It was a fractured D12 with paraparesis. It's like a no-brainer for a person who's doing spine, like quick up and one down. But the instrument given was a Charlie's hip retractor, an osteotome, a nibbler, a 4 mm kerosene punch. When I asked for cotton pledgets, cotton was provided. This was the general suction which was provided rather than a Fraser suction, a pair of forceps, Langenbachs. No bone wax, no gel foam, no ab gel, and this was the operating table and the workstation. So that's the ground reality where, actually practice starts. And then this is shattered glass in the operating room. There were scenarios where we were operating at Breach Candy, seeing the sunset. But this is the ground reality which you face. I was called for at a rural place for operating, and this is not a pair of chandeliers, but this is the operating OT lights. So you never know what might happen. This is me operating at an area where, the OT lights are fluctuating. So you need to fix it with a roller bandage so that it gets focused exactly at the area where you're operating. So I started my first case at a urology center, and you never presume where the people are trained. You need to observe them and teach them as to what you want. When I got a post as a visiting consultant, there were fake booking by super consultants, not giving me the operating theater or equipments to operate, so that I postponed my cases. So what I realized that you need to have your own set of equipments, your own toolbox, so that you can get any time out, you can bail out. Instead of OT lights, if that's not there, you should have a good set of operating headlights, battery operated. Loops do wonders instead of microscope. And above all, skill set is most important. So gradually you should develop a good team, which is an important anesthetist, a good OT, C-arm technician, assistant. They help you decrease your stress intra-op. A good CSSD guy helps in proper sterilization of your equipments. A good rehab guy and a good pathologist and radiologist, which this trust is built over a period of time. This makes your life simple, stress-free, easy, cutting short of surgical time, which is very important. Basic clinical acumen is period, you have to spend good amount of time with your patients to understand the problem, hear the story, and give a proper diagnosis. Stick to basic surgeries in the beginning of your practice. Don't try to be maverick and try to do heroic surgeries in the beginning of your career. Stick to conservative management. They also do pretty well. Cost effectiveness is very important in tier 2 cities. Patients will move out as far as less as 5,000 rupees to you're the next door surgeon. So you have to be very precise in that. And start running satellite clinics. You cannot be in your comfort zone or cocoon. You need to create and make yourself available and let people know that you are there. And try to make the city where you're practicing like a referral center like Mumbai, Delhi, Vellore in the years to come. So every week I have a satellite clinic, and I've been doing it religiously for the last 4 or 5 years, where I travel 500 kilometers either ways to reach out to population, because Jharkhand being a tribal state, majority population is in the rural area, around 75%. Well, the role of social media cannot be negated, but it's a two-edged sword. If things go south, people comment, and then you get trolled, then it's only going to bring bad name to your practice. Organic growth is very important. Patient-to-patient referral is just slow, it builds slowly and grows over a period of time. Do not follow the mob, what they are doing. You will be seeing a lot of pictures of endoscopy, high-end scoliosis surgeries. Stick to basics, what is good in your hands, try to do that. And very important is, like, whenever you enter a new city as ghost surgeons or you are asked for surgeries, you're always taken for a ride. So always evaluate your patients preoperatively. Check the surroundings where you're operating, whether things are there or not there. And as soon as the surgery is over, don't forget to take your surgical fees or remuneration. Because you never know, once you move out, you might never get your surgeon fees. Means I have lost around 20 cases where I have not been paid for in the last 2 years. So how do you stand among neurosurgeons, orthopedic surgeons, and spine surgeons? So one day I was roaming in the mall, and then I entered this Market 99, this concept, where everything was available at 99 rupees. So I thought, why not all the pathologies I fix a basic remuneration surgical fees? Whether the surgical time is 30 minutes or 3 hours. I fix it as an X amount, which is a basic no-brainer, and it can be approached by anyone. So patients will not be missed out, or you cannot miss out on patients because of economical constraints. So the other thing is, you should try to invest in equipments yearly, because importance of illumination and magnification in spine surgery cannot be negated. I think there is a talk by Dr. Tushar ahead as we go ahead in this forum on equipments to buy and what not to buy. So my first investment after a couple of years was a high-end Medtronic burr, followed by a tubular system, because in the state where I'm practicing, you have to get everything yourself. There's nothing available at the snap of a finger like working in metros, where you can be renting out things like this. So challenges are many. You have local fraternity who only do basic spinal trauma and some degen work. Since super specialty is all about referral practice, neurophysicians are the main people, but everything is conserved at their end, even from myelopathy to cauda equina. There's a lot of social taboos, quack treatments going on, and there's something called as Sera Gym or Nuga therapy. This is like a modified massage bed, which has gone very viral, and they aim to treat around 90 to 95% of the cases. As you see, people are lined up in this, and it's already free of cost. And once patient gets hooked onto it, they are tempted to buy this. So this is an interesting video shown by my patient. I find it very interesting because I feel like it's like a modified cupping therapy for low back pain. You see this old guy, people are flocking and lined up at his place to get this treatment done. This is exactly at the point of pain, I think, where the patient is, and this is the treatment which is happening. So there are a lot of scenarios like this. India is going global, but population in rural area is still facing a lot of issues. Data keeping is very important, so that it reflects back onto what intra-op findings were there and what surgeries were done, what implants were used. So important take is, like, personal growth can never happen as a full-time consultant at any institute. It's good for the initial days for, till you're economically confident, but you should gradually move to a part-time or a fee-for-service wherever you're practicing. Because corporates are, you can be replaced any day, you can never trust them. And try to settle in your practice as early as possible rather than roaming from pillar to post for fellowships. The ultimate case question you need to ask at a certain point of time is, what's your ikigai? What's your driving force? What gives you happiness? And what the area where you're practicing it, what you can be paid for and what the world needs. So the philosophy should be simple, easy, reproducible. There should be gradual switch over from techniques. You should follow the 1,000-day rule. It's period, and it's for all practicing surgeons. Neurosurgeons, ortho surgeons, competitors, group practice is the way to go ahead. If you have similar spine surgeons in the city with similar thought process, if everybody says yes to a case, patient definitely gets operated. When doing a complex case, if you get a hold of your friends or colleagues, it always helps out. Change is always gradual. There's something called as a BNI forum. If you're new to the city, this helps you get connected to local community people and people. You can express yourself and inform people about them. Every year, set up targets, like I like hiking and going for marathons, set up targets where you can go and, set and try to achieve them. So the future is, I started school scoliosis screening program in the year 2018, like creating awareness on scoliosis so that this can be taken ahead, and a neuro rehab center, which is with the help of a couple of patients and physiotherapists. It started last year, where it completes the entire treatment for spine, for quadriplegics, paraplegics, going to rural areas, taking talks with community health workers and Anganwadi workers every month. So there are a lot of ways, but indigenous ways sometimes you have to do to achieve the desired result. For example, sharing some cases with an operated failed back surgery with broken implant in an old guy, where sublaminar wire was done and the surgical cost was around 40,000. This is the patient's result. Patient walking in 3 weeks' time. Then this is a high-end grade listhesis with a lot of options. But when you have a quality of CM like this, how do you go ahead? That's the time when your training actually helps you out, and this is what we've achieved. Going into various types of gradually upscaling your skill and upscaling your game in different types of surgeries, going from high-end deformities to scoliosis, kyphosis, etc. So gradually pick up your game, A game gradually, not in the beginning of your practice. And whenever in doubt, take opinion of your mentor or guide, opinion of surgeons who are exclusive in the city, take their opinion. Opinions always help to clear your dilemma and take the right decision. On this eve of Guru Purnima, I want to thank Dr. Bhojaj as a mentor. Today, whatever I am, it's because of him, because of his philosophy. So you should always plan out like where do you see yourself standing in 5 years ahead, not facing the wall and saying that whatever decision you have taken is wrong. You would have a clear-cut decision in 5 years ahead what you want to achieve. So there's a saying, it takes 10,000 hours to truly master anything, and the time spent leads to experience, and experience leads to proficiency. The more proficient you are, the more valuable you will be. So the earlier as young guns you decide when and where you want to settle and what type of practice you want to pick up. Take up easy and simple reproducible techniques. You may be ready with all kinds of surgeries, but the society isn't. And you should always follow the 1,000-hour rule. Thank you.